It was a great lunch. I hope you had a chance to meet somebody new. My name is Mark Nolan. I'm the COO of Hint Health. Prior to Hint Health, I helped build and expand a DPC practice. And I know that many DPCs are also very interested in considering or in the midst of expanding their own practices. And so I'm excited to talk with these three individuals here and have them share their insights from their experience. Now, I have to say, this topic on its own could be its own probably 1 to 2 days of a conference, and so we can only go so deep in this session. But if you have any questions afterwards, please feel free to approach anybody on the stage. I'd be happy to talk about it. And we'll be saving about 5 minutes at the end of this for Q&A as well. So let's get started with some intros here. I was wondering if each of you could give us a little bit of context. Intro yourself, your practice, kind of what your experience with growth was.
I'm Dr. Deb Moore, and I am a 15-plus year family medicine doctor. I started Amarillo MD in Amarillo, Texas, 8.5 years ago with 0 patients out of my car doing house calls, and then we've grown to 1,100 currently and have 1 full-time nurse practitioner, 1 part-time nurse practitioner, and another part-time doctor, including myself. Yeah.
Hi, everybody. My name is Tom Daguanno. I'm the Director of Business Development with Plum Health. We're based out of Michigan, started in Detroit about 8 years ago. Currently, we have 5 clinics in the area, and we are majority now employer groups, but we originally started as retail, and we have about 20 employees across those 5 clinics.
Hi everyone, my name's Travis Bockenstedt. I'm the Chief Experience Officer with Pinnacle Advanced Primary Care. We are a practice with 3 locations, 2 in Colorado Springs and 1 in South Denver. Next month is our 3-year anniversary, and we've scaled from 70 members to close to 2,000 now. And about 70% of our practice is business. The other 30 are individuals. And we currently serve over 200 employers between 1 to 100 employees.
Cool. Congrats on the anniversary, by the way, coming up.
Thank you.
Travis, could you lead us off? I was wondering if each of you could share a couple things with the audience that you've learned through this experience, any advice that you'd give that jumps out at you.
Yeah, absolutely. So first and foremost, I would say don't do multi-location to keep up with the Joneses, right? Like, what I would recommend that all of you do is really think about who do you want to be as a practice, what type of culture do we want to maintain, and what does that growth look like for you? I would say that for those of you, all of us in here who are part of a DPC practice, we're all entrepreneurs, right? So I would think carefully about how much do you want to put on your plate, how much mental bandwidth do you have to launch additional practices, and some other advice I would give is give yourself a very long runway. We're not talking about this happening in your first year. If you're going to do multi-location, give yourself a very, very healthy runway that includes cash flow, that includes the energy that you have to do it. So, you know, I just wouldn't jump into it just because you like the idea of it. Really go to the core of why you want to go multi-location.
So Plum Health, Tom, you know, what occurs to you to share to people as they're thinking about this?
I think the area that people can get into trouble if they're looking at growth, you know, most of you, all of you are really physicians or providers starting your practice. That 0 to 1 step that you take, it's a certain amount of effort, but once you're in it, you're practicing, you're flowing, you find your flow. If you think you want to go past that, I think a lot of folks underestimate the amount of work it's going to take and how it's going to change your dynamic as a provider to now a leader, owner of something larger. And that's where people can get into trouble, at least ones that I've spoken with, even our own practice, maybe before I joined in the position I'm doing. It could be a hindrance, you know, when you're stuck, kind of, am I sticking with my full panel? Am I just doing this? Do I have that bandwidth to lead all these people you kind of have to make a choice at some point. So like, that's like what I call the 0 to 1, and then the 1 to 2, 3, 4, however, wherever you want to take it, it's different steps.
Sure. And Dr. Deb, you are also a clinician. What occurs to you? What have you seen and observed and experienced?
I see one of the pitfalls that clinicians can fall into is you're a doctor, you start your DPC, and you forget why the fee-for-service didn't work. If you weren't in fee-for-service, this is especially something I want to help you guard against, because one of the foundational things you need to understand is that fee-for-service, one of the reasons that independent physicians who opened their practices and failed was because the administration is so heavy on your overhead. And the administration being that the patient wants to use their insurance, and so they're going to ask you to do this and that, and you're going to hire somebody to do that. So in the fee-for-service world, that is why the overhead is so high. So you have to always kind of remember that and fight against that and guard yourself and your team from those requests. And you have to teach your team this too, because they're not going to understand. They're going to want to help. I don't know if you do personality styles. I'm an 8 on the Enneagram, which is very dominant, very, I don't mind someone being angry with me, and I've gotten even better at that now. So, but I have to have a lot of 2s and 3s around me, which are the helpers and those detail people. You need those helpers and detail people around you because as an entrepreneur, you have a lot going on. And so they're gonna want to jump in and help those patients immediately with whatever the patient guides them to. And you have to remind your team that the patient doesn't know how that's going to work out. And so we teach all our patients, you're usually going to pay less without insurance. And guess what? We don't bill insurance. Oh, we don't bill insurance. Oh, no, we don't bill insurance. I mean, just over and over. Oh, well, can you just do this pre-auth? No, we don't do pre-auths. Okay, so you do have to be really clear, and those that want to be there because your care is incredible will stay. So you don't need to be afraid of that. The other thing is that you're driving as the entrepreneur, the business owner, and the doctor. You are captain of a really large ship. It might be small to begin with, it might be a little lifeboat for you yourself, but then your ship grows and grows, and that is your team members, their families, and then all of your patients. So my ship looks like 1,100 patients on a ship with my 8 to 10 team members and their families that I'm providing for. So if I have a patient who's causing a lot of grief, compassionately what I do is I walk them over to the plank, and I walk them out to the end, and I ask them to jump off, and if they don't, I... And that's how I keep my ship afloat. And we do this every day. Not every day. We actually don't have that many patients we have to do that with, but the ones you do, you feel like you've just kicked off 100,000 pounds off the ship. And those of you who have patients, you understand this. And I want you to know it's okay to do that, and you should, in fact, do that, or you can sink your own ship.
Cool. Travis, what was the motivation for Pinnacle wanting to expand? And when did you think about this?
Yeah, so just to kind of set it up, our core team, the 5 of us who started Pinnacle, we had 3 years of direct primary care experience before jumping into our own practice. So we had some decisions to make. We really thought that we could move the movement forward by focusing on small businesses. I know a lot of people want the big fish we talk about in the room sometimes, the 100, 200, 300 life group. That sales cycle is quite long. You're talking about a year to year and a half to convert those. When you're looking at under 50 or under 25, you're looking at a maybe 60, 90-day conversion on that. We also find that we have a longer lifetime value with our business members. They stay with us for extended amount of time. Now, in our particular market, and all markets are different, for us to really grab that marketplace to play with employers, we knew first and foremost we needed to bookend Colorado Springs. So we needed one in the south end of town and one on the north end. And then we found some really great opportunity in South Denver. So it was kind of painful up front to do this, but downstream it really helped us grow in the long run. So our really sweet spot, when I say we have over 200 employers, we decided early on to let solopreneurs into our practice and give them the same buying power as we did a large company. Because those solopreneurs start to add 2, 3, 4, 5 employees, and the account grows with you. So that's really our core. Ideal client size is probably 10 to 20 employees. So that was our motivation to go multi-location.
Tom or Dr. Deb, was there a different motivation for either of your practices for expanding that might prompt this?
Not necessarily different, but I think when I stepped in, so I should preface, our practice was started 8 years ago by Dr. Paul Thomas. A lot of you know Paul, and he did a really great job growing it as the single location in that retail space. But he always wanted to grow larger, and really, we want to help the community as much as we can. And the best way to do that is it's kind of go to the source, right? Where are most of the folks in our area receiving health care, health insurance, through their employer? And so it was really twofold. It was, we know that's where they are, so we want to try and affect them at the source, but also the turnover, longevity. I mean, it really helps. What we call the retail members, there is higher attrition. So it also helps the company be more sustainable, right? Having something that's going to be there longer.
Makes sense.
Something I can add to that is I'm really passionate about, of course, helping doctors, nurse practitioners, PAs, nurses, everyone get out of the miserable world they live in the fee-for-service world. Not everybody knows this, but 1 doctor a day commits suicide in the US, and that's a really serious stat. I think it's a lonely place to be a physician anywhere. And so what I wanted to do was I wanted to make a really, really healthy, awesome place to work for those doctors who are looking for a way out so that they have another option. And also, a lot of them are quitting medicine. So some are quitting on life, some are quitting medicine. Both of those are terribly tragic. And we want to keep doctors doing medicine and enjoying it. So
For sure. As we talk about expansion, we're kind of thinking of this in terms of expanding the number of clinicians and the number of locations. And that 2 questions come to mind as I think about that. One is on the clinician side, and this has come up in a few conversations in the last day or so. Tom, I'll probably pose this to you. So how do I go about finding and hiring clinicians to help add to my practice if I so choose?
Yeah, I can speak to what we did, and it's probably unique. It actually really focuses on the brand. If you can build this brand, it's kind of 2-pronged approach. You want to build awareness in your community as much as you can. Obviously, that spreads through the patient base, but it also spreads through the provider base. The other thing, so that has driven a lot of folks to us. We will get resumes, sometimes 1 or 2 a week, from APPs or physicians that are reaching burnout, hear about us, want to join, looking for something. Not everybody has it in them to be a business owner, but they really want to join the movement, which is amazing. Yeah. So our problem in the Detroit market is actually we have more potential clinicians than we do actual patients right now. Yeah, I'm going to leave it there.
Dr. Deb, you're in more of a rural location, so you don't necessarily, I don't know, you might not have that same supply. How did you approach that?
Well, really our growth for multiple locations has been very organic. One of our nurse practitioners lives in Dumas, Texas, which is an hour north of Amarillo. And that's kind of, Amarillo is 200,000 or a little under 200,000 people. And then we have all these little towns that are small. But 13,000 people is plenty for a DPC. You only need 600. You only need a little bit. So she lives there, and she was straight out of school and would commute into Amarillo every day to train. So I told her, this is basically your residency year. It might be miserable, but you're going to learn a ton. And she really has. She's brilliant. So she's here, by the way. I won't make her stand up. She's really introverted. So I have 3 team members here that I would love for you guys to talk to. But that's basically how we picked that location. Was she's there with her family. She's part of the community. And we co-rented a chiropractor's office that she had a really good relationship with. and our overhead is really, really low, and that's really important when starting another location. So it's kind of organically, yeah.
Okay.
Where are the providers? Where are the doctors?
Travis, for you, I mean, sounds like you're in more densely populated areas and maybe less densely, wherever the employer is. Are you finding clinicians in the area, or are they coming in? How's it working for you guys?
Yeah, I think a lot of DBC practices, we don't have a shortage of a pipeline necessarily. I think one of the hard things is how do you take a physician that maybe is enjoyed their salary for a given amount of time, and then you're asking them to come into an entrepreneurial journey with you where they might not be able to pull that full salary that they want day one. So, I think it's really at where's this person in their life. I love the idea that we're capturing new clinicians when they're coming out of school, training them into DPC before they get jaded. But I think the other cool thing that we're seeing in the marketplace, especially here in Colorado, you can be a PA or an NP and have your own practice here in the state, which is really cool. So a shout out to all you NPs and PAs out there who run your own practice. I really respect what you're doing.
I should add, bringing medical students and residents through your practice, connecting with the medical schools nearby, showing them early what they can do, and then they go through the rest of their training, they'll remember that, and they will also come back.
For sure. I'm guessing there'll be some practical questions afterwards, like where do you actually go to find the clinicians? How do you post for that? So I'm going to hold off on that. But on the location piece that you started talking about, Dr. Deb, when I think back to when I was working and building out a DPC practice, one of the biggest considerations was whether it was a location even more or a clinician, how do I do this in a cost-effective way? Like, I don't have necessarily a full panel. Sometimes maybe I signed an employer, but I don't necessarily have a full panel that can support a new location or a new clinician yet. So there's some financial risk there. How did you approach that?
There's a lot of ways to address that. I personally did everything without debt, so I don't like to be in debt. I'm still in medical school debt, and I just didn't want to add that. I didn't want to make my own prison, as we talked about earlier, and I find debt to be really stressful. So I just made sure that, one, I didn't spend more than I made. I actually paid myself from day one. I just was always going to do that. Not a lot. It was about a third of what I would bring in total. So if you're looking for some math on that, it's a third of what you bring in total you should be able to pay yourself. If not, your overhead is way too high, way too high. So I think getting used equipment is really important. And then not making, this is really, it's a stupid decision, but it happens to the best of us, is don't buy a $40,000, a $70,000 x-ray machine. You have no business buying that right now. You've got to pay yourself. And I still don't have an x-ray machine in my office, and that would be a large purchase if I did. So be very simple with it. I garage saled my decor in my office, and I really enjoyed decorating, so I think it's great. Everybody loves it. And I bought used equipment, including my exam tables. I have couches in my rooms. A lot of those were in good condition, but used. So sometimes I think we're embarrassed to talk like that, or maybe you didn't grow up in a family like that, but it's really good. And if you're into recycling, you're recycling, so.
Can I add to Dr. Deb's comment there? I really loved what she said about not feeling ashamed of where you're starting. Like, we're at Skyridge Medical Center in South Denver, and they do a timeshare. So we timeshare 2 days a week with them. We pay for what we use, and it has allowed us to scale into a rather expensive market. Our next step is to move into our own practice in the next 90 days or so. But that's how we got started in South Denver. And then all of our clinics are not a Taj Mahal. These are just nice primary care practices that we flipped and refurbed and asked for a lot of tenant improvements.
Can I add something too? You asked the question about how would I help get another physician in or another provider. I actually use a few revenue streams that I used when I first started. So I did disability for the state of Texas, which pays really well and is not very complicated. And then there's a few other revenue streams that you can get into that you don't need to contract with insurance, and you can still be opted out of Medicare. And so if you need ideas, that's what I would do. I would save up, basically, is make my revenue higher until I had enough to start someone going. And I would also save up patients. I call it the bulge. So you kind of get more patients than your team can comfortably handle, which we're at right now, actually. And you all are working really hard. It's very bonding as well. But then that's how you can bring on someone without debt or without borrowing.
Great, thank you. I think we have just enough time for maybe a couple of questions from the audience. If there's anybody that has any, you could raise your hands, and I think we have a mic runner.
Hi, I come from a DPC family, but unfortunately I actually pursued finance, so I'm on the capital allocator side. I was actually kind of curious, have you ever considered like partnering with a capital allocator? And if you have, like, what would that ideal like kind of relationship look like?
Speaking for us, right now we want to stay true to the organic growth that we've taken. We think it's working well. We sometimes outside capital can have undue pressure on the business. So for us, it's not really in the cards at the moment. I think the time to take that on is when you have a couple puzzle pieces that you see coming together and you need that extra infusion to push them together. So there is a time and a place for it. So that's just for us right now, not something we're doing.
I see partnership with private entities as debt, just personally, and that would cause me a lot of stress, as I would now feel like I have to grow faster than I'm comfortable with, because I could be technically a lot bigger than I am, but I take breaks. You know, I move forward and then I kind of see how my team's doing and then take breaks. So it adds a whole different component to take capital from someone else. I have considered having someone purchase a building or something in the future. So if we could make sure the businesses were completely separate and I didn't have obligations to the person doing that then, but it is important to me to keep them separated.
Yeah, I imagine alignment and the vision and trust are really big things when it comes to that type of relationship. Any other questions? We might have time for one more.
Thank you. This is a question for the whole panel, but particularly for Dr. Deb. I've been in DPC 8 years, and I noticed there's quite a bit of difference between how women and men, business owners, experience the demands, both within their practice and also in the world balancing outside. So my question is, how do you guys see that gender gap amongst owners in direct primary care, and how is your personal partner supporting you in your endeavors, both within and outside your clinic, to make it more possible?
Well, I've been married over 20 years, and my husband's amazing. We are absolute opposites. You know how I said I'm an 8? Well, he's a 2. So we're a perfect 10. But so I'm entrepreneurial, I am project-oriented, I'm all those things. I am terrible at cleaning house and doing laundry and doing all of those monotonous things, right? So we embraced who we were, and as far as gender gap, I only see that as something self-imposed most of the time. I do live in Texas, and there's some like good old cowboy guys that just do business with their good old boys, but I don't let that really bother me or stop me. I just shake their hand and look them in the eye, and I'm a business owner just like anybody else, and so I don't really make it too big of an issue, but it can be an internal conversation you have with yourself about how you present yourself. And so I'd say, as a woman owning a business, don't be afraid to be successful, but also don't be afraid to do it differently than your male colleagues, because it does look different. We're maybe more emotional, maybe more relational, but that's exactly what you need to be as a DPC doctor. And I would say any of my male colleagues also have to be that way, and they often are. So I have some great friends in this room, and I would just encourage you all to get to know each other. And I would not be here today 8.5 years in if I did not have people to call and ask questions to. So I would have made some really bad mistakes if I hadn't had people to ask. And When I haven't asked enough people, I have made mistakes, and I've still made a lot of mistakes. So if you want to talk about mistakes, come talk to me.
I'll help you with that. Well, thanks. I think we're out of time here. I saw a number of other hands being raised, so please don't hesitate to approach anybody on the panel if you have follow-up questions. Like we said, this is a huge topic, and we've got a certain amount of time, but there's plenty of insights that could be shared even beyond this. So thank you, everybody. Thank you to our panelists. Appreciate it.
Thank you all so much. That was such a good panel. Thank you. Thank you. Oh, hey, Deb, will you tell us really quickly about DPC Nation and what's going on there?
Okay, so I started a website, and really the vision was to, you know, the DPC mapper, the good old DPC mapper, which I love. You can go on there and search by your zip code, right? Well, I made a map that is not just for DPC practices, it's for all the players in the space, because as you know, we're kind of in that stage in our movement, is that we're kind of teenage in the movement. We've got to have lots of people in the room with us. And so that map is for everybody. So if you will open up your cameras, click on your Chrome or whatever you're opening, and then if you can put your zip code in there right away and see who's there. It may be a completely empty spot, and that means you need to get there. So if you scroll down on your phone a little bit, there'll be a short little form you can fill out. So if you want to get on the map, go ahead. Really, the vision behind that is that lonely doctor who's a hospitalist or thinking about leaving medicine or overwhelmed, that they would be able to Google this, and I'll get the SEO just right, and it'll pop up, direct care. What is this direct care? Then that would lead them to the map, and they would immediately be able to find you who's in their city, and then strike up a conversation together. Because that's just what I feel like might be missing in this movement, is those of us who are in DPC and maybe ready to hire or expand are having trouble finding out who that is. So we'll have potential doctors, we'll have potential employers, imaging centers, surgery centers, hospitals, and all the DPC clinics. So thank you, guys.
Thank you so much. That's awesome, because it is really sometimes hard to find like who's where, especially I have a lot of patients